Hi, Remar nurses. It is Monday. We have an amazing NCLEX review. Plus, we have our NCLEX questions, plus Monday motivation. All that is coming. But the priority for this new week is to increase our faith, increase our belief that we can do this. And the way that the Remar nurses help to do that for us is they come on and they give their testimony. So I know I have nurses. Let me know where you're from. I know I have nurses in Africa, in Maryland, in Jamaica. New Jersey is also in the house. Of course, New York is here as well. But Nurse Tanisha, am I saying it right?
Yes, ma'am. Hi,
Tell me,
everybody.
tell Remar nurses what you come to represent today.
Well, I just want to tell everybody that what Regina says, follow it. It is true. I am actually a Raymar nurse. I recently took my exam June 26th, and the next day got my results and online, and I was just like amazed, like really amazed. I couldn't believe it. I studied for 3 weeks.
Wow.
I followed the schedule. I was doing it day and night. So
Wow.
I also used the Quick Facts book. I
Mm-hmm.
did that. Uh this is my V2. It's
Nice.
all highlighted.
Oh, look,
Written.
I like to spotlight the difference between a
Yeah.
brand new V. This is the brand new V2. It's
Yeah.
empty, it's blank. So
Yeah.
that shows that you were watching the videos, you were doing
Yeah.
the work.
Mondays, Wednesdays, I would be on listening, writing notes, writing in my quick fact book. I
Mhm.
just like I have
You
papers
did the work.
everywhere. So
You did the work. So talk to me about was this your first time taking NCLEX?
yes, very first time, didn't know nothing about NCLEX. Of course, I'm in Atlanta, Georgia.
Okay.
I went to Herzing University, and I mean, I've been using the quick fact book all through nursing school.
Wow. Okay. Okay. That's quick facts. Quick facts can be used in nursing school. All
Yeah.
right.
I
So
went
tell
to the
me,
Raymar classes.
that's RNU.
Yep, the one that just recently finished.
Yes.
I did that as well.
You've
You
been
have to
working.
be dedicated.
You do have to be dedicated. Talk to me about, I'm sure when you graduated, you had many different recommendations on what you could use to study. Tell me what made you say, I'm going to go with Remar.
Well, I always watch YouTube videos, and
Mhm.
for some reason, like I just saw your name and I saw where you are Christian based. I am a Christian based woman as well.
Yeah.
And the prayers with Mark, and I just like motivated Mondays, the
Hmm.
prayers. I mean, it just gravitated for me to do you. And
Awesome.
then I also had brought my quick fact book to school.
Okay.
And I showed a couple of my girlfriends that we have this little pack, and everybody else they went to get it too. So I have another person. Her name is Tremel. She used Raymar as well. She took hers on the 10th, and she passed as well.
You need to be a Remar rep. I need to get you in the Remar Rep program. That is amazing. That is, thank you so much for just taking quick facts with you to school, taking it with you to school and showing people. I love that. I love that. And that's why I made the book so that you could take it anywhere and just have it. So thank you so much. Can you talk to me about when you were doing the V2? What what did it help you to understand, or what connections did it make that you didn't have maybe in nursing school, if any?
Well,
Like,
with
tell me
with me, it's like I was in an accelerated class,
how.
which I
Okay.
didn't know that I was in an accelerated program.
Okay.
So everything went like fast, fast, fast. And
Yes.
me trying to keep up. And I saw my book is like, this is my book. It's like coming apart because
Oh yeah. Oh
I
yeah.
like literally like took it everywhere with me.
Okay, okay.
um I what I when I didn't understand and it was just like right to the point, I can look up, I can see what I needed.
Yeah,
My stuff is all highlighted, as you can see.
I do see that. I do see that.
Highlighted, written in, color coded. I mean, it just gave me a better understanding.
Yeah,
And the videos for the V2, they really help. They right to the point. If I didn't know something, if I missed something, I would go back and watch a YouTube video that you have that's saved on YouTube. I
yeah.
mean, I surrounded myself with nothing but Raymar, basically.
Wow. The community that we have built allows you to do that. And I know people may look at it and see it's me, but it's a lot of you. It's a lot of you showing up to those events. It's a lot of you printing out the workbooks for the events, taking notes, buying quick facts, buying the V2. It is an entire process that you have to go through. And this is what it's like to train for a major exam. So you
And
did the training.
not only that, it's very reasonable.
Hmm.
Actually purchased the V2 like back in October of last year.
Okay.
I paused it, and then when January came, I unclicked it, of course, because I was preparing for my exit exam.
Got it. Got it.
So I started using it then, $50 I upgraded and I said, okay, it's time to get serious. I graduated
Do it.
back in May. It took a while for our ATT numbers to come across.
Hmm.
And when I got my number, I was like, okay, I got it like June the 6th.
Okay.
And I said, okay, June 26th is the date.
So,
And
and that's ideal for anybody that's watching. The way you did it is ideal. When you have that ATT, when it first drops, you should be able to set your test date that same time because you've been studying, you feel prepared, you're ready to go. So you gave yourself about 3 weeks, to finish up anything that you needed to clear up, and you sat for that exam and passed it.
yep,
That
and
is
I
what it
passed it
should
with
look like.
89 questions. 89 questions. And I
Okay,
was
let's
like, wait, what?
No, that's good. Talk to me about how you felt during the exam. Why do you think it shut off the 89 questions for you?
I went in the exam and I'm not gonna lie, the first like 10 questions, I was like, what the heck? I
Mhm.
laid my head down, I said a prayer, and I said, I can, I will, I must pass NCLEX. I'm not leaving out here without passing it. I said, okay, Lord, you have to be with me. I pulled myself together and I just focused. When I went in there, I really wasn't nervous or anything.
Mhm.
I was just like calm, and I'm a person that has test anxiety really bad. But once I got through the first 10, it was like, okay, boom, boom, boom. I started going through it like it was nothing. And I had a lot of case studies, a lot of prioritization questions.
Wow. I love
Mhm.
I am so I'm so happy for you that you didn't allow, feeling of test anxiety come over you in the beginning and throw you off. So you stopping and saying a prayer, that probably grounded you to be like, okay, keep your head in this game. Don't
Mhm.
take your head out of the game. So important. So important.
And
Um,
a lot of my friends, they had went to 150. So I was like, okay, I prepared myself. Okay, I'm going to 150.
yeah.
So
Yeah.
I got to 85 and I was like, okay, let me click and see. I said, oh, okay, I guess I'm going to 150. So
Mhm.
I kept on, and my last question, which I know was 89 because it was a bow tie. And I was like,
Okay.
oh, I know this. This is peptic ulcer disease. And I just start clicking it
Awesome.
away. And once I hit submit, it shut off. I was like, oh. And I thought something happened and I just raised my hand, didn't move or nothing. And person that was watching tapped me and said, "You're finished."
Amazing.
And I was like, "No way."
That's great. That's great support. I just want to say thank you so much for sharing your testimony. Let us know what you do now. You and I talked, and you just told me today was a big day for you. Tell me what did you do?
Yes. Today was my first day actually on a job. I was a nursing student at Northside Atlanta Hospital doing my practicum, doing mother baby,
Mhm.
and I was just, doing what I'm supposed to do as a nursing student, trying to learn, have hands on, and every day I would talk to a certain individual and never knew she was the nurse manager. Never knew she
Mm,
was the hiring person. And she
there it
was
is.
like actually interviewing me every day. Didn't know. Talked to her. She's like, "Did you put in for an application?" And I was like, "Well, I didn't think, you'll hire nursing students now." She's like, "No, go ahead and put in your application." And I put in my application and everything. And I went through the process. And next thing you know, I got
Oh,
hired on for mother baby unit.
mother,
So
baby, and
actually,
twin.
I'm going to be a postpartum nurse at the same hospital that I did my practicum.
Congratulations.
Thank you.
Congratulations. So many nurses want to get into maternity, OB, mother, baby, and you landed your first job as a new nurse with no experience
Experience.
and in a specialty like OB. And
Yes.
so that's going to streamline the rest of your career, honestly.
Mhm.
So congratulations. And then I just
Thank
want to
you.
point out your story because listen, how you go to clinicals, your attitude, your demeanor, are you friendly? Or are you on your cell phones? Are you short with people? Are you, those things make an impression on people. You have no idea the position of those people. You have
Mm.
no idea. So
And
shout
you
out to you.
and you never know who you're talking to. So you be mindful what you say, who you say, what you say. You
Mhm.
really just go there and learn. That's all
That's
they want you to learn.
that's right.
Jump into it. If you can help, help.
Mhm.
If you want to know something, ask questions. I'm a person that asks a lot of questions. So I want to know how, and I do want to participate. So that was just how I am. And I also
Mhm.
make the patients feel comfortable, you know.
Exactly. Exactly. All good things. All good things that you are saying. All and so your experience is so important. Thank you so much for sharing your story, your
Mhm.
NCLEX journey. Congratulations passing on the first try.
Thank
89
you.
questions. That's a dream. And you graduate, you get your dream license, you get your dream job. And so everything is up for you. God is definitely blessing.
Yes,
He heard your prayers.
and the first thing when I got that email that next day, I was running through the house saying, "Thank you, Jesus. Thank you, Lord."
Yes,
I had
yes, yes,
tears
yes.
coming down my eyes. I was like, I've been trying to do this since I was younger. This is my third career. I'm 52. I'm gonna be 52 in September.
Oh, you look
Uh,
good. You look
Thank
good. You look
you.
good. Wow.
Yeah, I left one career, retired actually from one career, was in the military, and this is my dream job. So
Wow. So congratulations on just being courageous in so many things to
thank
transition
you.
a total career shift, going through nursing school. And this is what I love about the Remar nurses, non-traditional, just doing it like saying, hey, I'm going to do it my way. You want your life to be how you want it to be. You want to do what you
Mhm.
love. And you're already, you didn't won the race.
Thank
Seriously,
you.
because before people can get to the finish line, you already didn't had a whole career. You probably know how to do so many things you learned through the military and all your other careers. You're bringing it into nursing. Whoever has you as a nurse is going to be in such good hands. I can tell already.
Oh,
So
thank you so much.
yeah,
Thank you
yeah.
so much.
Thank you for coming on here and sharing your story with us. I hope you have an amazing nursing career. Don't forget about us. Come back and just say
No, I'm
hey.
trying to be a rep. I am
Okay.
participating to be a rep as well. so
Okay,
I can help, and encourage people to guide to your way because it's the real thing.
thank
Raymar
you.
is real. It's very helpful. And matter of fact, I have my daughter. She lives in San Antonio, Texas. She's
Yeah,
in school for LPN, and I already sent her all the
send her
material.
my way.
Yes, I have. And she
Send her my
graduates
way.
next year.
Oh, I
I
can't wait
sure.
to meet her.
Mhm.
Okay. All right. Bye-bye.
Bye,
Oh,
everyone. Bye. You
thank
can. You will. You must
you.
pass NCLEX. You can do it, y'all.
You hear? You hear? She's the goal. She's the goal. Her life, her career. I love the fact that what I love about her is that even if you're doing something, you might be really good at doing something else. You might be really good at doing something else, but nursing is your passion. Nursing is that thing that's like, I want to try that. I really want to try that. And she jumped into it. She said she's 52 years old. I did not see 52 years anywhere. I didn't see it, but she said she's 52. Amazing. And going to be starting in mother baby. Oh, man. Man, how lucky are her patients going to be? That's the Monday motivation right there. I don't even know if I have to do another one, but anyways, let's get into it. We are here to talk about disaster management. Okay, disaster management. Disaster management is a topic that I do cover in the V2. It has its own video. So if you have the V2, please check it out. Very significant for us in our learning. Also, don't forget that I'm talking about the V2. I'm saying that is where the NCLEX review materials are. There is a free trial of the V2 for those of you who don't have it. Please send me an email, support@remarreview.com, if you want to know where the free trial is and if you want some information about it. Again, I'm asking you guys to email me today, support@remarreview.com, because there are specific questions that you have, and those questions are actually probably prohibiting you from starting the NCLEX review. And it's more important for me to just absolutely direct your questions to the right people or answer them myself so that you can get started in the review. I have many people that are just like, hey, I would have started the review 2 months ago if I knew how to do this or that. And so I want to cut all that out so you can actually get your license. I said that the year is ending soon. And my goal was to help everybody in 2024 get in a position to be able to test and pass the NCLEX. So as we are getting ready to close that year out, I have some people who should have already passed that have not even set an NCLEX test date yet. So if that is you, please don't delay. Just go ahead and send me that email so that we can get you in a position to be ready to test. Okay. All right. So disaster management, going over it. And shout out to Nurse out for those of you who are watching me and you're all over. Um, we do send the products everywhere. And so this makes me very happy. Nurse Navarro, am I saying it right? Hi, thank you, Remar. I received my V2 physical book and quick facts today in Dubai, UAE. So I'm so glad that it made it to you and that now you're able to start your NCLEX prep with me, So let's talk about disaster management. Let's get into it. When we are talking about disaster management, you do need to be able to identify what are the disaster types. Let me get the page for you. Somebody's asking for the page. Disaster management is in the V2 workbook, so it's in the blue book. And I see somebody says page 61. It is page 61 in my book too. Okay. So when we're talking about disaster management, what we are talking about is this. It's a disaster that can be any natural or man-made catastrophe. And the whole goal for NCLEX is that it is going to disrupt or interrupt the medical care of patients. It may also prohibit patients from getting medical attention that they need. So, what is your responsibility as the nurse? It says here, this catastrophe, it produces an interruption, a destruction, or a devastation and necessitates outside aid. Although natural catastrophes such as What do we have? Earthquakes, storms can cause many disasters. Predictable and avoidable human made elements can exacerbate the disaster. So saying yes, a disaster can be it can be enough by itself, but normally these situations are compounded, especially if human made elements or human made conditions are involved. Types of disasters, let's get into it. Natural disasters. So, natural disasters, let me make this a little bit bigger. Natural disasters, these are things, okay? These are things that we must consider. The timing and the type of the disaster will determine the types of injuries or illnesses that occur. Natural disasters include what? Earthquakes, hurricanes, floods, tornadoes. How many of you have these in your area? Tsunamis, typhoons, volcano eruptions, wildfires, landslides, mudslides, extreme heat and snow or extreme cold. So, depending on the region where you are, will be the type of natural disaster that you will experience in the nursing field. Now, for NCLEX, we have to know about all of these things, right? But in Ohio, we have to know about extreme cold and snow and also tornadoes. The other things I really don't have in my area, but I know if you're in Florida, you got these hurricanes, you got floods, you have some other things. So when we are thinking about working in hospitals, working in inpatient, assisted living, these types of natural disasters will all come into play, There's also a type of disaster that is a weapon of mass destruction. These are the human made biochemical agents. You can have just regular chemical agents. Also, radiation can occur as well. For the biological agents, if we just stop here for a second and think about the three that I said here, biological agents, chemical agents, and radiation, if we are presented with this topic on the NCLEX exam, what are our priorities? What are we going to be thinking about? Well, the most important thing that we think about is, what is our assessment? Our assessment is going to be, well, what are the clinical symptoms that distinguish this particular man-made agent from something else? All right. Also, what is the incubation or transmission mode? So very important. How is this thing transmitted? Okay. Isolation. We know that there are 4 types of isolation that you must know for NCLEX. Do not take this exam without understanding this principle. Okay. Isolation precautions, the standard. Okay. Now there's some other things here. I just have here the main ones in terms of transmission. So we know hand washing is going to be the best way to prevent transmission of diseases in general under standard precaution. Contact precautions. What do we have here? If we're coming in contact, especially with a biological agent, this is what you are going to assume. You're going to assume that, of course, you need to do your hand washing. You need to wear a gown. You need to wear gloves. You need to wear goggles, shoe covers, and you need to put this patient in a private room. And this is because this is a biological agent. So with biological agents, you got to kind of take it up a notch. Okay. Gonna have to take it up a notch because you don't want, typically biological agents are extremely harmful. Okay. Droplet, you're going to be wearing a mask in this case. All right. It could be a surgical mask. You can add a positive pressure room. Airborne, hand washing, respirators, negative pressure room. Identifying the specific therapy, identifying the specific cause I meant will help you implement the specific therapy. So the cause of it is going to relate to the treatment. It's just like in other diseases. If you have a virus, then you would use an antiviral, not an antibiotic. Okay. If you have a bacterial source, then that's when you would use the antibiotic. Immunotherapy can be used if you have inflammation as a response, or if you have something that is attacking the immune system. We also know that it's very important to know who is exposed, who could be the source of the biological agent into the environment, right? We're always looking for patient zero. So that is the contact tracing. Protective equipment that we're familiar with for the NCLEX exam, you should understand how respirators are working to help you. You should also understand what helps a respirator to fit well and the protective clothing that is used. So that's the gown, the shoe covers, those things. Chemical agents can also cause natural disasters. Chemical agent can also cause disasters, not natural, man-made, I apologize. So the chemical agents that I have here, and these are ones that you want to write down in your V2 workbook: pulmonary agents, cyanide, vesicant, and nerve agents. So these are my notes. For pulmonary agents, these are going to be substances that, when inhaled, produce pulmonary edema, okay, with little damage to other pulmonary tissues. So what is the main thing that they are going to do? They're going to create hypoxemia, okay, and hypovolemia. Cyanide agents. These are gases or solids that have hydrogen cyanide in them. Okay. Now, hydrogen cyanide is very deadly. So with certain concentrations, high concentrations, and you don't need to know the number, but you do need to understand that death is imminent. Okay. Death is imminent within 6 to 8 minutes. Vesicants. Vesicants are going to attack a patient's skin. So they cause vesicles or blisters. Common agents are sulfur mustard and lewisite. These sometimes also can be more lethal than pulmonary agents and cyanide. And then nerve agents. These are liquids or vapors that are the most toxic of all chemical agents. They're going to attack your patient's nervous system. They're going to shut down the patient. And so you have sarin, tambun, and soman. These are examples. So just some chemical agents. All right, again, this should be added to the blue book. People are asking, is this in Quick Facts? No, this is not in Quick Facts. This is in disaster management protocols, because there's also a priority that you should know when you're treating patients in disaster management. And so this is going to come from the blue book here with my face on it. This is the one we're using for disaster management. As always, we went over some protocols. What I want you to do is I want you to do some NCLEX questions now. And these questions just help to see if you are fluent in this specific subject. If you're not, guess what? That's okay, because we're still studying. You're still in the process of training. I have 3 questions. I like for you to get one of the 3 right, because these can be a little challenging. So can we do 1 of 3? Let's try it. All right, first question is this. Let's go. All right. A nurse responds to a radiation attack with fully equipped PPE. As the nurse approaches the client, the first priority is, number 1, assess radiation exposure to the environment. 2, assess medical conditions and establish care. 3, decontaminate the most stable patient first. Or 4, dispose of all radioactive objects from the treatment space. Great question. The nurse responds to a radiation attack with fully equipped PPE. As the nurse approaches the client, the first priority is what? Is it 1, 2, 3, or 4? Let's see what the Remar nurses are saying. Looks like we are getting it down to, well, I was going to say 1 in 3, but actually, there are some people that are, I don't know, they're all over the place. That's okay. I love this. I love when this happens because this is why you come to class on Mondays at noon, so that you are able to just go over these types of scenarios that you may have never been in. Remember, NCLEX is going to put you in scenarios you probably have never been in to help you see if your clinical judgment, critical thinking is on point. Correct answer here is number 2. Number 2. This is your priority as the nurse. Don't let NCLEX have you doing things that you have not been trained to do. You haven't been trained to decontaminate an area. We don't get that training, okay? We don't get the training of doing social work. Sometimes NCLEX will have you, in a position where they're asking you, hey, should you go make sure that the home environment is safe and things like we're not social services. Our priority as nurses is to assess what? Medical conditions. We've been trained to do that and establish care. This happens whether you're in a disaster or not. A lot of people pick number 1, excess radiation exposure to the environment. That's not what we're doing, right? We're not trained to do that. Number 3, a lot of people pick decontaminate the most stable patient first. What does that even mean? What does that mean? All right. 4, some people have picked 4, dispose of all radioactive objects from the treatment space. Again, we don't have the training to do that. So be very, very careful, because I know we want to do it all. But NCLEX is not the place to say that. It's not the place to say that. All right, let's try another one. Question number 2 says this. There is a suspected attack of cutaneous anthrax. The nurse prepares the following precaution to implement. Here we go. Number 1, standard precaution. 2, contact precaution. 3, droplet precaution. 4, airborne precaution. How you answer this will let me know if you've taken my V2 or not. It will absolutely let me know. If you've studied with me, you won't ever get this question wrong. We're talking about cutaneous anthrax. The nurse prepares which isolation precaution? Is it standard, contact, droplet, or airborne? Okay. I see the answers on the screen. The correct answer is number 1, standard precaution. Remember, anthrax right here, we're talking about cutaneous anthrax, requires standard precaution. Isolation, such as contact, droplet, airborne, not necessary. You have my student workbook, page 102, isolation precautions. We go over the list of isolation precautions. For those of you who don't have it, actually, you can look at 102 for that question. 101 is the list of isolation diseases that you need to know. Okay, so let me give you some of them. We have AIDS, diarrhea, mononucleosis, hepatitis C, rotavirus, shingleosis, epiglottitis. Some of these are in the Quick Facts book as well. You need to know this list right here. Okay. So when you guys are thinking about getting this book, because a lot of you are saying, like, I need to get this book. You want to get this book. Understand that when you get this book, it is blank. There is going to be a lot of blank spaces from this book. I'm trying to see, because you are supposed to fill this out watching the videos in V2. Okay. All right. And so that is the purpose of the blue book. It is for you to watch the videos and fill it out with the videos. So when you get this book, just because some people email and say, hey, the book is empty. The book is not filled out. Yeah, this book is going to be empty because you got to watch the videos. Okay. All right, let's go back into the questions. Here is the next question here. Question number 3, let's talk about it. A nurse is working in a hospital that has been affected by a landslide. The hospital is being evacuated due to the risk of further landslides and damage. Okay. The nurse has to prioritize which patient to move first. Okay. Which patient are we moving first? Which patient should the nurse prioritize for evacuation? Number 1, okay, a 45-year-old male with a fractured leg in stable condition. 2, a 70-year-old female with a history of dementia, currently confused. 3, a 30-year-old female in active labor, 7 centimeters dilated with no complications. Or 4, a 60-year-old male with a history of COPD who is on continuous oxygen therapy. Okay. Again, this is a principle you must be able to do. I position you to be able to look at these questions and know exactly what is your priority. Okay. And this will also help you save time when you're taking the actual NCLEX exam. Correct answer here. This is very obvious who the right answer is. You got this one right. You got this one right if you picked number 4. Number 4. This is an internal disaster with landslides. Okay. So that tells you a lot right there. That tells you a lot right there. The 60-year-old with COPD who is having increasing respiratory distress should be the priority for evacuation because this patient, their situation could rapidly deteriorate. You don't want to leave this patient. This patient, you need to make sure that they are evacuated and they have adequate oxygenation. This helps for them to live on. Okay. Now, going back to the other patients, some of you guys picked 1. A lot of people picked 1, 2, 3. If you are not able to clear these questions on the NCLEX, or if it takes you a long time to figure it out, you will certainly drop below where you are. Okay. You might even drop below the passing standard. Prioritization, management of care. This is the biggest part of your NCLEX exam. You must be able to do these types of questions. And the way that you do these questions, let me tell you this, the way that you practice these questions and get better at these questions is not just doing them over and over and over again. It's not just doing them. You have to understand the principles of how to get to the right answer with prioritization questions, particularly in disaster situations. So if you're not doing well now, don't just think, oh, I need to just do a whole bunch of these questions. No, because every disaster changes. You have to understand the principles of disaster management. Okay. This is going to be key. This is going to be key for that. So that's why I did 3 questions today. Disaster management. This is a topic that it's not critical thinking. Let me say that again in terms of how to behave. It's research based, it's policy based, it's principle based. So these are questions that easily can be accomplished, achieved, and done for nursing students. Okay. All right. But again, it is not something, again, and this is why this is not something that's in quick facts. Okay. This is not a quick fact thing. There are some things that are quick. You just need to know the numbers, the structure, you get it. Disaster management is a principle. It's a principle. And so that's why I put it in here. Okay. It's a principle. You need to hear it. You need to go through the different situations in order to understand it. And that's part of the training that you have to do. You got to do the training. All right. I want to reorient. Some people are like, yes, I did it. That's why I said just one question today. If you got one of them right, then you're on the path of understanding. Okay. You're on the path of understanding. All right. Disaster management is on page, I believe it's 61 of this book. Yeah, it's on 61. Okay. All right. Here is a note for my nurses who are in Africa. All right, for my nurses who are in Africa, please check out Callion Nurse Consultings if you are going to be taking the V2. If you're going to be taking the V2 and you need the books and the training, Callion Nurse Consultants has that information for you to get started. And again, the reason why I want you in Africa to go through Callion Nurse Consultings is because they already have the books on your continent. So if you order them from myself, you're going to have to pay for US customs. You're going to have to pay for the additional shipping. And so I don't want you to do that. And they have a very sweet 6-month training for you guys with the V2. Please reach out to them. The information is there. Okay. The information is in right there for you to write it down, screenshot it. Absolutely the best way to get into the V2. And I would say you absolutely need to have this training too as well. So save yourself some time and connect with them. Okay. If you have any kind of questions for me, please go ahead and email support@remarreview.com. Support@remarreview.com. Okay. All right. And then so that's what I want you to do. My Mary, thank you, Mary. I'm able to look at some of the contents. I have my V2. I really like it. I'm so glad. I'm so glad. That's great. Okay, my motivation for myself, and you know that when I do motivation for myself, I'm really sharing it with you all. I hope you can relate to where I am. It's the idea, it's the principle that God is never late. Sometimes when we look around, we want to be further along than where we are. We feel like I should be in a different position in my career. I should have a different house. I should have a different car. I should have, lost this amount of weight by now. I should be able to, write my book, my ministry. There's so many things that when we look at ourselves, we really wish that we have, accomplished more. But what I'm finding is that what God has for me is always going to be for me. What I am intended to do, no matter what circumstances come, who I may gain during the process, who I may lose during the journey, I will end up where I am supposed to be. And I have to have that as part of my faith walk. I have to have that as part of my journey. And so I just asked the question, like, people make promises. A lot of people make promises, but not everybody can keep the promises that they make. Even yourself, you can make promises and not be able to keep them. I think a lot of people can relate to this, where they're like, I told the kids we were going to do this and we didn't get a chance to do this. Or I promised myself by this time I would be living in a different city and I haven't gotten there. Okay. So I know that we can all relate to that thought, but there's one person who can always keep the promises. And this is why I love the word of God. It is 2 Peter 3:9. The Lord is not slow in keeping his promises, as some understand slowness. Instead, he is patient with you. Oh, this is it. He's patient with you, not wanting anyone to perish, but everyone to come to repentance. And when people talk about God being, a mean God or a harsh God, or this is actually not what the Bible tells us about God. The Bible actually tells us that the Lord, he doesn't want anyone to perish. He doesn't want anyone to not receive the blessings that he has for them. And for us, most of the time when we are not where we're supposed to be, there's a reason why we're not there. It's a reason why we're not there. And the trials and tribulations that come into our life, they're to help us to develop a character. They're to help us to develop, for a lot of us, patience, for a lot of us, kindness, for a lot of us, joy, and not this kind of conditional thing, like where we're happy when things are good, but when things are bad, we're depressed and we're down and we don't see the good of anything. Like, we have to get to a place where we are content when things are going good and things are not going good. And we have to understand that of all the people who are making promises to us, God's promises are sure. They're sure for us. And so the takeaways for the Monday motivation is God does not change. He does not forget, and he does not lie. And time, this is so important. Time with God is not the same as time for us. We are so, everything we do, we're, especially in America, we are so governed by time. When something starts, when something stops, we are pressed about the time we have. We feel the pressure of it. We feel the pressure of time here so much. And God does not feel that. He's outside of time. He is the Alpha and the Omega. He already knows your end from the beginning. So when he decides to open up a door, you can be sure that is indeed the right time for you to walk through it. Because sometimes when we try to open up doors before we're ready, when we go through those doors, we find I'm not in a situation, I can't handle this situation. There are so many things that I rushed into that now I have no idea how to handle. And I see that happening a lot in people's lives. They rush into situations, they rush into decisions. Oh my goodness. And then when they get those things that they weren't ready for, they cannot handle them. And so then you have to go back and start all over again. Nobody wants that, especially us who's so worried about time. And so we do have to understand that God's timing is always best. And man will fail you, but God won't. But God won't. So this week, who are we putting our trust in? God. Who are we keeping? Who are we, keeping our patience for? And who are we waiting on? And who are we working and serving? God only. Okay. Because if we get that part right, all these other things will be added. Everything else that you want. The Bible says what? Matthew 6:33. Seek ye first his kingdom. Okay. All these other things are going to be added on. But understanding that God's time is not our time, and God doesn't fail. So during this week, trust in that. Okay. Talk to God. Anything that is overwhelming you, anything, especially if you're feeling like, oh goodness, I should be so further along, or why don't I have what so and so has, or God, I've been asking for the same thing that I see other people being blessed with. Why don't I have it yet? Okay. Just know that God says, when the time is right, I will make it happen. I will make it happen. So Monday motivation has been served. Thank you guys so much for attending our class today on Monday. I will be back on Wednesday night, 9 p.m. We will discuss another topic. We will join together as a community, show each other that we care. Amazing testimonials. By God's grace, someone will come on and tell us that they have made it. I'm looking forward to it. I always ask, who's next? I know there's some people that are waiting for results. I know there's some people that will be testing later on today, testing tomorrow, and we will hear from them. We will hear from them. For those of us who are still studying, make sure that you are doing your part. Make sure that you are doing your part. That is doing the lectures, listening to those lectures. Sometimes you might have to listen to them when you are cleaning. Not necessarily, maybe you don't have the book and you can take notes, but you're cleaning, you're driving, have that stuff on. All right. I have no problem when I'm going to pick up my kids or going to the grocery store. I will put on a lecture in a minute because my mind is where the work is done. Okay. The question banks in V2, the computer adaptive exams, those are good for, assessing yourself. The books are good for taking with you. I love Nurse Tanisha said she took the book with her to school. She showed it to people. It's just because you can put it in your purse. Most of us are carrying purses that are too big anyways. So we can put the book in there. And of course, following the daily study schedule. Okay. If you do the V2 program by the daily study schedule, you are able to finish this program in 30 days. Even more so. Even more. Some people do it in, I think somebody said they did it in 7 days. I don't know. Okay. I don't know. You did it in 7 days. You did it in 14 days. That's because you were following the daily study schedule. So this is about saving you time. This is about shortening the process to getting acclimated to NCLEX. This is about, somebody's already cleaned the dishes. Well, come on, clean mine. Come over here and clean my dishes and we can listen to V2 together. This is about you getting your nursing license. That's what this is. Everything that we are doing together here is to support you during that journey, so you don't have to do it alone. So on Wednesday, our study group will be back to further along the mission. I get excited about the questions, the NCLEX questions, seeing how you do in them, seeing as well what you'll say in response to the questions. I read the comments later, and sometimes I laugh because you guys are like saying something very funny about your experience with that question. So it just brings me joy when we come together. So I will see you guys on Wednesday night at 9 p.m. Remember this, if nobody has told you, write this down when you're taking your NCLEX so that you don't forget. You can, you will, and you must pass NCLEX. See you guys later. Bye-bye.